I'm Dr. Alan Moses. I'm the Global Chief Medical Officer for Novo Nordisk. Novo Nordisk has been involved in the treatment of diabetes for nearly 90 years. Really, only 2 years after the discovery of insulin, August Crowe got a license to produce insulin in Denmark, and we've been on the forefront of innovation ever since. But it's not just about the innovation of the molecules and making new therapies for patients. It's also about trying to prevent the disease, type 2 diabetes specifically, but very much in terms of working with governments, particularly in less developed or underdeveloped countries, to assure that patients there have access to the care that they need in order to do better. In fact, our CEO, Lars Rebien Sørensen, is going to be at the UN conference next week on non-communicable diseases to actually help make the plea for greater efforts towards improving diabetes around the globe. That's both treatment and prevention, and to try to spur governments into doing more. It's really a tragedy that diabetes is increasing at the pace it is, and it's one of the diseases where we know that effective treatment not only improves the lives of patients, but actually also reduces the cost burden for the individual and for the society, i.e. it saves money for the healthcare system if you treat it effectively and early. And yet, unfortunately, we wait too long and have to deal with the complications, which is where the costs really rise. I think this is really a first effort for the United Nations to deal with non-communicable diseases, and I think there's an increasing recognition amongst certainly major health organizations like WHO, and I hope governments around the world that NCDs are becoming an increasingly important part of the ill health or the lack of health of their populations and the costs that they face. You know, getting politicians, and indeed they are politicians, engaged in this process sometimes takes fairly drastic measures. What I hope is that the pendulum will begin to swing in the other direction, that is, away from worse outcomes from the disease, before it swings so far that it's really going to be a health disaster for the globe. And yet, countries, appropriately so, have worried so much about feeding their populace, about improving the hygiene of their populace. And there's much still to be done there. But when you achieve that, and when you begin to mechanize, that is, use cars instead of bicycles or buses instead of walking, you run into this problem of decreasing calorie expenditure, increasing availability of calories, moving toward foods that have higher caloric density, i.e. the Western diet, and you then result in weight going on. It's a particular problem for Asian countries because those populations are more susceptible to the ill effects of weight gain even than Caucasians. So they don't have to become obese in Western terms, but they only need to gain 4 or 5 kilos and they begin to manifest some of the metabolic abnormalities that lead to or can be diagnosed as diabetes.
So you have ongoing projects in
we do. We have projects around the globe. We've been working very actively, specifically in China, with the Ministry of Health and their Diabetes Association to try to improve the education of physicians there and to try to help those organizations actually put the pieces in place to improve the health of their. The Chinese, in some respects, are very well equipped to do this because they have more control over the system, but they also have a huge problem because they have a very large population outside the cities who are at risk, have a relatively low income, they have to distribute the medicines, etc. But they have the systems to do that, as opposed to some parts of Africa where we supply insulin at a very low cost. That's part of what Novo Nordisk does to help countries that are underdeveloped or developing, but we still can't assure that insulin is going to be distributed to the patients who need it, or in fact that low cost is going to be maintained, because when that low-cost insulin is imported by Novo Nordisk and then arrives at a local pharmacy where the price is jacked up 4 or 5-fold, and patients still can't afford it. So there are all sorts of issues that that need to be addressed and that are really a major problem for the globe and particularly for people who suffer from diabetes today.